But I was going to talk to, I'm Dr. Gary Gibson. I'm a family practice doctor down at Internal Medicine Clinic. Been here about 15 years. I grew up in Meridian, actually in Collinsville. Graduated from West Lauderdale in 1990. Went to MCC for 2 years, then went to Ole Miss and got my bachelor's there. Went on to medical school in Jackson at University Medical Center, where I graduated in 1999. Did my family practice residency in Jackson also, and then came back home for practice. Been here for 15 years. So. I'm married. I have 3 children. I got a boy that's 13, a boy that's 8, and I have my little blue-eyed redhead who's 5. People keep asking, she's adopted, and people ask me, my wife's got brown hair and brown eyes. People ask me all the time, where'd she get the red hair from? And I say, from her daddy. And then my wife beats me up. But I was going to talk to y'all a little bit about preventive medicine and just some things to do to ensure good health and just to keep yourself healthy in the future. Why bother with preventive medicine? You can prevent illnesses from occurring in the future with preventive medicine, and I'll go through a few things to help out with preventing health issues. In particular, I'm going to talk about weight loss. I'm going to talk about high blood pressure and diabetes, and also I'm going to spend a little time on vaccinations. But also to maintain a healthy lifestyle, to prolong life, and importantly for a lot of people, there's a lot of insurances require you to have the Healthy You exam or the yearly wellness exam. They'll give you a little incentive, like they'll give you a little bonus if you get the exam. Adverse on the other side of it, they can penalize you if you don't. The insurances we have at the clinic does that. So Blue Cross Blue Shield is what we have. So on your yearly physical, that's a once a year thing. That's a good time to review family history with a physician. One thing we learned in school, that if it runs in the family, if grandparents, mother or father has it, then you can expect it, especially in particular high blood pressure, diabetes, heart disease, stuff like that. A lot of cancers too, breast cancer, prostate cancer in general. That's also a good time to talk about vaccinations. Make sure you're up to date on those, and I'll hit on a few of those in a minute. Also to go over any questions or issues that you may be having. The one little caveat I'll put there is on the yearly physical. If you go into a lot of detail about problems, a lot of times, and if we address a lot of those problems, a lot of times the insurance won't pay for the yearly physical and they won't count it as that. An example I like to give, which I think is silly, but an example I like to give is I had a patient who's a friend of mine came in about this time last year. He came in, did his lab work for the yearly physical. The day of his physical, he woke up with a bad sinus infection. He came on in for the yearly physical, but he started telling me about the sinus infection. I said, well, I can address this, but insurance is only going to acknowledge one thing, and usually it's the acute visit. He said, I'll come back tomorrow for the other. I'd already had his labs printed off. I handed them to him. I said, they all look good. We'll talk about it again tomorrow. I took care of his sinus infection, gave him shots, got him well, or gave him antibiotics. He came back the next day for me to do the exact same exam. I said, well, we've already gone over the wellness labs. You're fine. So that's how silly it can be. And that's a lot of times with insurances, that's what the hoops we're jumping through. But I did mention lab, and I'll go over a few little things with lab. It's sort of restricted on what we can draw on the yearly physicals now. But I'll go into more detail on that in a minute. Also, it's a very good time to discuss weight loss and smoking cessation. I spend a lot of my day doing that, and I'll go over that a little bit in just a few minutes. On vaccinations, the main one right now is the flu shot, the influenza shot. That is a shot that's given once a year. It's recommended for everybody, basically. This is the time of year to get it. I normally start giving it about mid-October, and I give it to the end of the year. It takes about 2 to 3 weeks for it to get into your system and to work. This year, it's been a little bit different. The flu started hitting in September. we got an email from the Mississippi State Department of Health about the middle of September asking us to go ahead and start the flu shots. Now you'll notice like at some of the pharmacies like Walgreens and CVS, they advertise flu shots starting in about May or June. Don't get them then. By the time flu season hits, it'll be out of your system and it won't work. Wait till about, I usually say wait till about October or November. This year was different. September is when it hit. Uh, what has me a little bit worried about the flu shots this year and about flu in general, flu is typically a cold weather bug. When it was hitting in September, it was 80 and 90 degrees. That has me worried that there's a different kind of strain out there that the flu shot's probably not going to work against. I still advise everybody to get the flu shot, but I'm worried that that may not work too well. I've been telling folks that, and there was 80 cases of flu by the middle of September in the state of Mississippi when they sent that email out to us. 18 of them at the University of Southern Mississippi. So they had an epidemic down there pretty much. The other shot would be the pneumonia shot. That's typically given to people age 65 and older. It can be given to younger folks if they meet certain criteria, such as if they have chronic lung or chronic heart disease like COPD, asthma. If they're immunocompromised, such as HIV patients, patients with sickle cell anemia, patients with cancer undergoing chemotherapy are immunocompromised. We give those the pneumonia vaccination. There's two of them that's out there. The older one, or the Pneumovax, covers for 23 different bacteria or 23 different bugs that could cause pneumonia. That one in the past we've given every 5 years. About 2 to 3 years ago, they came out with a new one called Prevnar 13 that covers for an additional 13 bugs. The way they ask you to do it now, if you've had the Pneumovax within the last 5 years, to wait a year or wait until it's been at least 5 years before you get the Prevnar 13. Then wait another year and get another Pneumovax. If you're younger than 65, you continue to get the Pneumovax every 5 years. If you're older than 65, I've actually read it two ways, and I got some recommendations right off the CDC's website in preparing for this that says now over 65, if you've had the Prevnar 13 and the Pneumovax, you're good. Now you don't need any more. But younger than 65, you still get it every 5 years, which I know everybody in here is not there yet, but at one point we will be. The next one would be the shingles vaccination. I see a good bit of shingles, and the shingles vaccination is a one-time shot in folks who've gotten the shingles before. And now in the patients who get the shingles, it's caused by the same virus that causes chickenpox, the varicella zoster virus. When you get the shingles shot, it is a one-time shot. You do need to wait 2 weeks. If you've had the shingles, wait 2 weeks after you've completed the therapy for it. But it's a one-time shot. It doesn't completely eliminate the chance of getting the shingles, just like the flu shot doesn't completely eliminate the chance of getting the flu, nor does the pneumonia shots, but it greatly reduces it. And what I also like to tell patients, and what I've seen in practice, is that the folks who've had the shingles vaccination, when they get the shingles, if they get the shingles again, it's not as severe. Now, the down point of it, insurance will only pay for it if you're 60 and above. If you're younger than 60, they usually don't pay for it. My wife has had the shingles 4 times. The first time was when she was pregnant with our 13-year-old. And she's had it 4 times or 3 other times since then. She's 47. Not old enough for insurance to pay for it. And I understand the shot's about $100, or maybe $150 by now. I may be needing to pony up and pay for that, because we've talked about it. We just haven't done it. But when I was going over this last night, she wanted me to practice on her, and this is about where she fell asleep when I was practicing right after this. But she said, "Yeah, I think we do need to pay for that." And then she heard me talk about the next one, and then she fell asleep. But it does reduce the incidence of it. The next one I want to talk about is the Tdap. That stands for tetanus, diphtheria, and acellular pertussis. that's one of those childhood immunizations we get. Uh, we do recommend getting boosters every 10 years with that. Uh, or if you suffer a bad cut and are running risk for tetanus, or especially a dirty wound, like if you get cut on a dirty piece of metal, dog bite, something like that, we carry Tdap at our office, but you can also get one that's just the tetanus and the diphtheria. We do recommend it if it's been 5 or more years since your last booster, if you get a bad wound, to try to avoid tetanus. Uh, Next one is the human papillomavirus. That's the virus that causes genital warts. This is more important for younger females. They usually give it, we don't give this at our office. This is going to usually be given through pediatricians or through gynecologists. But it's usually given to unvaccinated females through the age of 26. It also can be given to males age 22 through 26 who are immunocompromised, but also homosexual males have a tendency to get the human papillomavirus. It is a series of 3 dosages. The importance of getting this vaccination is that if you get human papillomavirus or the genital warts, you have an increased risk for cervical cancer later on. So it does reduce that risk. That's the importance of that one. And that's the only reason I even bring that one up today. The next one is the MMR, the measles, mumps, rubella. That's one of the childhood shots that we all received. Series of 3 when we're, or series of 2, excuse me, when we were born. Nowadays, it's if you were born after the year 1957, or if you're in a high-risk populations, such as myself, healthcare workers, college students, and folks who are international travelers, they recommend getting an MMR booster. One little story I have on that: when I was about a senior in high school, I went to Ole Miss for a competition, and about a week before I was supposed to go up there for that competition, they had an outbreak of the measles. So my doctor knew I was going. He called me up, come in and get your MMR before you go. And of course I was fine. It was gone. I think those students were all at home that day anyway. But that is, for folks who are going to be somewhat confined, it's good to get the MMR. Hepatitis A. There's 5 different kinds of hepatitis. Hepatitis A through hepatitis E. If you're going to get a hepatitis A is the one to get. It is self-limited, meaning it's not forever. It does play a course and go away. It's usually just like a stomach virus. It acts like this, and you get it from eating food that's infected. When they taught us in medical school, they always told us the story about this famous restaurant in New York, and they didn't mention the restaurant, that the salad chef had hepatitis A, and he infected thousands of people in New York. And then they would start to go right into the hepatitis A vaccination. So I was thinking about that when I saw this. It is usually recommended for people with chronic liver disease, and once more for people who do a lot of international travel. You can think going to some of these third world countries, you might be exposed to hepatitis A, among a lot of other things. But it is a series of 2 shots. It is given 6 to 18 months apart. Hepatitis B, that is the hepatitis you don't want to get. That's the bad one. That usually leads to cirrhosis of the liver and liver failure. People get those usually from the same way activities that you can get HIV from: sexual contact, IV drug use. It is a series of 3 shots. It's also recommended for high-risk people, like people who live or close contacts with people with hepatitis B, or like myself, healthcare workers. I had to, before I could go into medical school, start medical school, I had to have at least 2 of the 3 shots. Like I said, it's a series of 3 shots. You get 1 shot, and then a month later you get the second, and 6 months later you get the third. You can alter that a little bit if you're sort of confined for time. You can get the set as long as it's 4 weeks between the first 2 shots and 12 weeks or 8 weeks between the last 2. And the last vaccination I want to mention is the varicella vaccination. I mentioned the zoster for shingles a while ago. This is the chickenpox vaccination. This is for folks who've never had chickenpox or shingles. I've never had chicken pox. When I was in school and all the kids had chicken pox, I was out with pneumonia, so I missed that week. So in medical school, I had to get it because you can imagine I'm exposed to it. But it's given to all adults without evidence of immunity. I had to do a blood test to show that there was no antibodies to this virus in my system, and then I got the series of 2 shots and given 4 to 8 weeks apart. Um, varicella. It's a blood test. Right. Folks who know they've had it, I mean, if you've had it, you know it. They're very, folks who've had it, they'll tell you. I never had it. And when I was in medical school, my roommates didn't think he had ever had it. So we went to the student health when we learned about the vaccinations in one of our classes. And of course, we heard that. And one thing about medical students, everything we study, all of a sudden we have. We're diagnosed it ourselves. So both of us went to student health, and they drew our blood. He came back immune to it. I came back not immune. So I had to get the shots. He was fine. So, but there is a blood test. We draw it. I'll even draw that blood test if folks are not sure if they've ever had the chicken pox and are asking about the shingles vaccination. There's no evidence of it, but I'm always afraid if I give the shingles vaccination to somebody who's never had the chicken pox, then I'm going to give them the chicken pox. So I'd rather check and make sure rather than cause chicken pox. um, y'all can't see this, but I had put a slide on here that sort of goes over what I just went over about how often you can get it. I would turn around and let you see it, but it's too small. Lifestyle modifications for preventive medicine. I mentioned diet earlier. Uh, it, Several reasons to watch your diet, and I'm going to go into blood pressure and diabetes and weight loss in a minute. But I usually recommend an 1,800 calorie diet. What I have found is that usually folks who a 2,000 calorie diet for the average male, uh, you're going to break even on weight. 1,800 calories, you'll probably lose some. If you could eat even less than that, that would help with weight loss even more. A few years ago, I got pretty. I decided I was going to lose some weight, and I put myself on a 1,500 calorie diet. It was tough, but I lost weight. Then Thanksgiving came around, and I said, "Well, I'm going to ease off my diet and exercise program." And I just got back on it about 3 weeks ago after I gained every bit of my weight plus 10 pounds back. So, uh, but there is an app on that you can get if you have an iPhone called MyFitnessPal. It's a very good app. It's a free app. It helps you count your calories. Now I've gotten back into it, and I just started putting my calories in the last couple of days. But even if you eat out, like last night, my kids wanted pizza, so which is when you're on a diet, that's one of the worst things you can eat. But we stopped and got Papa John's Meat Lovers Pizza. I plugged it in there, and after I did, I wish I hadn't because I'd blown my diet.
You get one bite. You get one bite.
Yeah, if you're on a 1,500 calorie diet, that will pretty much take care of it. Uh, yeah, when I first started doing this 4 years ago. Actually, I started on my wife and I anniversary, and we decided to go out to eat. She wanted to go to Chili's, and there's a certain dish there called a chicken bacon ranch quesadilla. I got one; it was good. Then I plugged it in here, and I found out it was 1,700 calories. Uh, we were that night we were going to take the kids to Olive Garden. I said, "Well, I'll start my diet tomorrow." We went to Olive Garden, and I don't even remember what I ordered that night, but it was another 1,900 calories. So I really blew my diet that day. But you can be shocked how much when you plug it in, how much some things are. Some of the dishes that you can get, if you can even plug in just the ingredients, and you can figure it out. One thing I found out is you get 5 calories of just chewing gum. Just plain spearmint gum is 5 calories. So, but I do recommend that, and it helps with keeping up with calories and help with weight loss. Uh, Also, I recommend a low fat, low carb diet. I'll go into it a little bit more with carbs, but low fat needs to be about 20 to 35% of your total caloric intake. So, and to figure out how much fat you need to have in your diet, you do that and then divide it by 9, because there's 9 calories per gram of fat. Each gram of fat has 9 calories. So on an 1800 calorie diet, I figured it out for you, that'll be about 50 grams of fat a day. And you can look on the labels, it'll tell you how much fat is in each food. And this app will also tell you how much fat's in the food. Of course, usually you've eaten it by the time you put it in there. We'll find out later. Low carbs, I do recommend low carbs, because carbohydrates turn into sugars, and that's very important for diabetics. And I'll hit on that a little bit more. There's 4 calories for each gram of carbs, and it's recommended to have about 45 to 60% of your total caloric intake. I figured it out on the low normals for 1800 calories diet. That'll be 225 grams of carbs a day. So it's 45 to 60% of total caloric intake divided by 4 for carbs, 20 to 35 divided by 9 on the fat. On exercise, I do recommend about at least 30 minutes of exercise a day of good brisk walking. I've started doing that. Like I said, I decided I wanted to get rid of this, and I started doing that in the last few weeks. Hadn't seen any results. Got on the weight on the scale this morning, hadn't lost an ounce. But I've been doing it pretty religiously for the last 3 weeks. One thing I have noticed, and I'll add this in now, if you're on a diet and exercise program and you find that you're losing weight and then all of a sudden you stop losing weight, don't get discouraged. Typically what we see is weight loss, and then it'll plateau out, and you may go weeks before you start seeing weight loss again, but if you stay with it, the weight loss will come back. That's more for me than for y'all, because I'm a lot bigger than anybody in here. So, but that is, if you are on a diet, don't get discouraged, because that's when it plateaus out. That's when most people get discouraged and stop their diet and exercise program, and then the weight comes back. But the other thing is, with exercise, the other recommendation is to get about 10,000 steps a day. The Fitbit is an excellent way of keeping up with that. They count your steps. I used to have one at home, but I got the Apple Watch, and that'll keep up with it also. Apple Watch will even keep up with how many calories and carbs you burn in a day. But you got to have it on for it to measure it. So, also, going back to the MyFitnessPal app, one other little thing I want to throw in with that, for it to work, you also have to put everything that you eat into the app. If you decide to eat a Snicker bar and say, well, that's going to put me over, I'm going to leave that off. It don't work that way. So, another lifestyle modification would be smoking cessation. There's several things that can work on that. You got the patches. You can get those as prescription or over the counter. If you are a smoker and want to use the patches, that is an excellent way to stop. The one warning I would give you is that if you put the patch on and you have strong craving and have to have a cigarette, take the patch off. It'd give you a nicotine overload if you smoke with the patch on, because you're getting a steady dose of nicotine with the patch. There's also gum you can get that's over the counter. I understand they taste horrible. A lot of patients say they'll try it and then want to go to something else. There are medications, and I'm going to hit on it a little bit more later on, like Chantix and Wellbutrin. I've had some really good success with Chantix. It's a little expensive, but it works well. And then, of course, hypnosis will also work. Weight loss, the key to it, and I've sort of already hit on most of these things, but the key to weight loss is to burn more calories than you take in. So if you can limit your diet to at least 1,800 calories, 1,500 even make it easier, but it's hard to stick with a 1,500 calorie diet. And then you could get at least 30 minutes of exercise in, whether it's walking or running. Another little side on that, you're going to burn about the same amount of calories whether you walk or you run. It's just the amount of time you do it. You'll burn it a lot quicker running than you would walking. But if you can burn off more than you eat, you'll lose weight. And it's common sense. The more you burn off, if you're using up more than you put in, it'll go away. But of course, diet, exercise is important with that. And you're going to notice, even when I go over some of these other things, I'm going to say diet and exercise on just about every one of them. And I'm also one of the key offenders of that because I'm way overweight. But then the weight loss medications, I hit on those a while ago a little bit, but there's older ones out there called there's one called Xenical that's been out 10 or 15 years. It blocks fat absorption in the gut, and it will lead to weight loss, and it's one of the safer ones out there. The problem we found with that is that if you happen to take that and then go eat a hamburger or a fatty meal, it's going to give you a terrible, foul-smelling diarrhea, and you can imagine patients don't like that. Others out there like Meridia, it's not as used as much anymore, but what it does is it decreases your appetite. It's an appetite suppressant. Contrave, that's a newer one out there. It's got an antidepressant in it. Some of the weight loss clinic in town will use it, but I haven't seen a whole lot of results with it. I personally prescribe it. Belviq is the newest one. It's on the market now, but I'm not convinced about its safety from the safety profiles. I'm one of these, when a new drug comes on the market, I don't jump at it. I got to see that it makes sure it's safe before I use it. So I'm not convinced about it yet. The only weight loss drug I will write is basically Adipex. That one also helps decrease your appetite. But the problems with all of these is that these medicines can cause heart arrhythmias or funny, weird heart rates and liver disease. Y'all remember there was one called Fen-Phen that was out in the 2000s. It was really bad about that, and they took it off the market. These can also do that. For that reason, I'm a little hesitant to write Adipex even. I have certain guidelines for all my patients that I will give Adipex to. They got to be 350 pounds and have a medical condition like blood pressure, high blood pressure, heart disease, diabetes, or back pain where weight loss is essential to controlling their problems. Going back to the diet just for a second, you hear about all these fad diets like Atkins diet, South Beach diet. I think there's a Caribbean diet or a Mediterranean diet. They work. They do work, but they're next to impossible to stay on. Anybody who's been on Atkins will tell you they'll lose weight, but they get sick of staying with that diet, and when they come off the diet, the weight plus friends come on. So the best way, to simply put, the best way to lose weight is the hardest way. Diet and exercise, low calorie, low fat, low carb, what I mentioned earlier, and really the best exercise is to push weight from the table. So that's where I have problems. I like to eat too much. With obesity and weight loss, one tool you can use is the BMI, or the body mass index. We do calculate it for all of our patients. What it is your height in kilograms divided by your weight in centimeters squared. A BMI less than 27 is considered normal. Between 27 and 32 is overweight. Above 32 is obese. Above 35 is morbidly obese. Mine's 33. I'll go ahead and tell y'all. So I am obese. With weight loss, there's been studies out there that's shown that if you can lose 10% of your total body weight, not like if you weigh 200 pounds, if you could lose 20 pounds, studies have shown that if you're on blood pressure, diabetic medicines, you can, with 20-pound weight loss, you can start looking at being able to come off of some of your medicines, or at least decrease them. And then if you lose even more, you can decrease even more. One of the patients I saw this morning, before I came up here, about 3 or 4 years ago, she weighed 250 pounds. She weighs 140 today. She's got high blood pressure. When I first started seeing her, when she weighed that much, she was on about 4 blood pressure medicines. And I decreased the last blood pressure medicine or the only blood pressure medicine that she's still on, to the lowest dose today. going to get her back in 3 months and hopefully get her off of it. So that she's proof that that works. Uh, high blood pressure, once again, diet and exercise. With blood pressure, and particularly a low salt diet. Salt works on the kidneys, and that raises blood pressure. So if you come in with an elevated blood pressure, if you come in and see me with an elevated blood pressure, I'm not going to automatically put you on a blood pressure medicine. I'm going to ask you to watch your diet and all but eliminate salt. Just season a little bit to taste so your food won't be bland, but don't add to it once you get to the table. And if your blood pressure stays up after that, then we'll talk about blood pressure medicines. But exercise and weight loss is important in high blood pressure. The other one is decreasing stress. That's one of those that sometimes we can't control. As a doctor, I can't control that. There's some personalities that are type A personalities. Usually you see that in doctors, you see that in lawyers, you see that in CEOs. They're on the go all the time. They're wound tight. I'm one of the few doctors that's a type B personality that's laid back. It drives my wife crazy because I don't worry about a thing. Sometimes she tells me I need to worry about things. Most doctors are going to be wound tight. I'm exact opposite. So from stress standpoint, I shouldn't have high blood pressure. From an weight standpoint, I am on blood pressure medicine. So if I can ever get this off, maybe I can get off the one blood pressure pill I'm on. Diabetes, not to sound like a broken record, but diet and exercise and weight loss. That's the things to do. I mentioned the low carb diet earlier, low sugar diet also for diabetes. I didn't say no sugar, I said low sugar. And if you can use some of these sugar substitutes, that's fine too. But the sugar substitutes can be a problem too. There's a lot of cancers linked to a lot of the sugar substitutes. Well, what I tell my diabetic patients, and I'll go it this way: if you're going to get sugar, I would prefer you get the natural sugar that's in fruits. You're going to see sugar in grapes, oranges, apples, bananas. Matter of fact, when you have low blood sugar, we usually give you orange juice. If you're going to get a sugars, they'll raise your sugar some, but not like the sugars that you get in a candy bar or some of these foods. So to answer your question, there's really not a good way. You sort of have to pick which one you got to look at. Uh, if you're obese and diabetic, I would probably say be careful with the sugars. But if you can lower your fat grams, that will help get the fat off and help out with the sugar diabetes. I'm not a diabetic, but that's the reason I've really gotten myself back on a diet and exercise program. I've been really lax the last few years and let myself go, but this scares me. I'm also adopted, so I don't know what to expect from a family history standpoint. So I don't know if I can look forward to high blood pressure or diabetes or heart disease. So when I get to thinking about that, it's scary. So that's one reason I got myself back on this kick. I just need to stay with it at times. Smoking cessation. If you are a smoker, you do run the risk for lung, heart, and heart disease. You can think of it this way: anywhere that smoke travels when you're inhaling it, it can cause cancer. Whether you think of the lung cancer, but it can cause esophageal cancer, it can cause throat, mouth cancer, and it can even cause stomach cancer in some degree. So that's one important reason to stop smoking, let alone the COPD and asthma and emphysema risk that you run. But then again, smoking also increases your risk for high blood pressure. It increases your risk for heart attack and stroke too. Multiple reasons to stop smoking. There are several medications that you can take to stop smoking. I mentioned Chantix and Wellbutrin earlier. That's the two that we use the most. Wellbutrin is an old antidepressant. It's a decent antidepressant, but it helps decrease your nicotine cravings. Um, it's not, I haven't seen it work the greatest on that. Chantix is a newer one that's been out a couple years. That's the one I've seen work the best. You take it usually for 3 months. What I usually do is I start people on Chantix and tell them, and it is safer to take Chantix and smoke. If you have a craving and have to smoke, it's not going to give you nicotine overload like that patch would. But it does decrease your cravings. What I have found with them, I'll have them start the Chantix, set a quit date for a week or two later, and then you try to stay off the cigarettes after that. If you have a huge craving and need to smoke, you can smoke. That's no problem. It won't hurt anything. But the beauty of Chantix, what I found is that if you do smoke, it makes the cigarette taste horrible. So sort of an added benefit of trying to get off cigarettes. Uh, Last thing I want to go over is just age-specific preventive procedures that you can have. Uh, this is your basic stuff like pap smears and mammograms in women. Pap smears, and this is the latest American Cancer Society recommendations. American College of OBGYNs have a little bit different, but I put the American Cancer Society recommendations. They say from age 21 to 29 in women to get it every 3 years. OBGYNs, their recommendations is yearly at that point. Once you go through postmenopause, and American Cancer Society still says every 5 years from age 30 to 65, after age 65 is not necessary. OBGYNs, until you go through menopause, it's yearly. After menopause, they're okay with every 2 to 3 years. And then when you get to a certain age where the treatment of a cervical cancer would be worse than having the cancer, then you don't have to get it again. A lot of these cancers and a lot of these things, you got to think about sometimes the treatment's worse than having the condition, so why test for it at that point? Mammograms, once again, American Cancer Society says yearly from age 45 to 54, every year of the year after the age of 55. American College of OBGYNs is yearly up to age 65, then every other year after that. For men, PSA for prostate cancer, American Cancer Society says for average risk person start at the age of 50. The old recommendation was the age of 40, and I still go by the old recommendation. And I recommend getting it yearly after the age of 40. But the American Cancer Society says yearly after the age of 50 for average risk. Start at the age of 45 for high risk. That would be with the first degree relative or the African American community. And then start at the age of 40 for the highest risk if you've had more than one family member with prostate cancer. Once again, I recommend the old way, start at the age of 40 and get it every year. And another little aside on that, that's the blood test, PSA blood test. I don't like doing this exam, but I do recommend the old rectal exam too, because you can, with the blood test, you can miss some prostate tumors that you won't miss with the digital rectal exam, and vice versa. You can miss one with a finger sweep that you won't with the blood test. So it's recommended to get both of them. Colonoscopy. Usually you start that at the age of 50. You get those every 10 years. That, of course, is looking for colon tumors and decreasing your risk for colon cancer. Usually GI doctors do that. Starting at the age of 50, every 10 years. If they find a colon polyp, they usually like to start doing them every 5 years after that. Last but not least, bone density. You think of that more in women, but it's important in men too. That's the test for osteoporosis, weakening of the bones. That should start after menopause. Insurance won't pay for it until you're age of 65. It's every 2 years. There's two types of bone disease. There's osteopenia, which is just weakening of the bones, and then you got osteoporosis, which is the bad one where you're at an increased risk for fracture with the least little fall. There are treatments for that. There's injections, there's infusions, and there's pills for it. That's outside the scope of this talk. But at the age of 65, every 2 years, you can get the bone density. All right, that's all I got. Any questions or anything? It's X-ray. I'm sorry, I meant to say that. It is an X-ray. Our office, we used to do them in our office, but we started losing a lot of money on it. I think because we weren't ordering enough. So it's done at the hospital for us now. We have formally given the infusion for it, which is, and then we've also given the injection called Prolia. I just found out yesterday that we were losing money on Prolia too. If we were getting so little back from insurance companies on Prolia that if we ordered it for one person, they rejected it, we would lose for the whole year. So we decided, well, we'll send that to the hospitals for them to do. So, but yeah, it's a special X-ray. Usually they do it of the hip and of the leg.